which is it's part of our communication strategy so that we can get the word out about COVID-19. What is it that we need to do in terms of prevention? And also to hear from our partners who are working along with us in this preparation and readiness exercise for COVID-19. We also think it's important to hear from you, the general public, to understand what you would like to know, to take your questions and your ideas. So thank you for coming, and we hope that today, with these 3 sessions, would be productive. Thank you.
Thank you, Dr. Nisbet. And now we will be having an overview of the coronavirus, COVID-19, history, transmission, symptoms, prevention, diagnosis, and treatment. And that would also be presented by Dr. Nisbet.
So I'll be discussing, as Madam Chair said, some aspects of COVID-19. Now, in December 31st, 2019, WHO informed of 44 cases of pneumonia of unknown cause. Most of the patients were linked to a seafood market, a seafood and live animal market in Wuhan City, Hubei province in China. Now, this seafood market is one that sells seafood and also is also termed a wet market or a warm market. In other words, this is where animals, including wild animals, are slaughtered. A novel coronavirus was detected in samples taken from some of these patients who presented. And since then, the outbreak has spread rapidly, and as a result, on January 30th, the World Health Organization declared COVID-19 as a public health emergency of international concern. So then, what are coronaviruses? Let us start off first by answering the question, what are viruses? So viruses are small infectious agents that replicate only inside living cells. There are many types of viruses, and they infect all forms of life. Humans, plants, other animals, even bacteria they can infect. And some of these viruses are associated with disease. And one such virus that is associated with disease are the coronaviruses. The coronaviruses is a large family of enveloped RNA viruses. Of course, I think everyone knows that we cannot see viruses with our bare eyes, and in fact, we need electron microscopes to see viruses. They're very small agents, infectious agents. Coronaviruses are found in animals, but coronaviruses can cross species from animals into humans. And they cause respiratory illnesses. And what we mean by respiratory illnesses is that they affect the airways that start at your nose, your mouth, the back of your throat, and down to your lungs. Now, do they infect humans? Yes, they do. As I said, they can cross over from animals to humans. And there are 7 known to infect humans. There are 4 that cause mild respiratory disease, such as the common cold and other mild respiratory diseases. But we know of 2, SARS coronavirus, that appeared in 2002 in another province, not Hubei province in China, but another province in China in 2002, 2003, and it did not go beyond 2004. That is caused by the SARS-CoV virus. In other words, the severe acute respiratory syndrome coronavirus. And MERS is caused also by a coronavirus called the Middle East Respiratory Syndrome coronavirus. And that caused MERS in 2012, and MERS is still ongoing. And it is still considered a public health emergency of international concern. We are not too familiar with MERS and SARS because MERS and SARS did not actually, have not made it to our part of the world. SARS has made it to Canada, of course. There was an outbreak of SARS in Canada, cases of SARS in Canada, but we never had SARS in the Caribbean, and we have not had MERS either in the Caribbean. MERS is more or less confined to the Middle East. And now we have a new one. This is now the 7th coronavirus known to infect humans, and this is the severe acute respiratory coronavirus 2. Because of its similarity to the SARS coronavirus, and to distinguish it from that virus. So it is not the same virus, but it is similar. So as I said, this is the 7th coronavirus known to infect humans. It causes the disease, coronavirus disease, 2019, shortened to be called COVID-19, because it is in 2019 that it was discovered. It is a recombinant virus. That is, it's made up of genome from different species. It's a recombinant virus between coronavirus found in bats and an coronavirus found in an unknown species. It may have come from bats, for example, to an intermediary host and then to humans. Now, the intermediary host is not known as yet, but scientists are working to find out what is that intermediary host could possibly be. One of the theories was that it's snakes. However, that was refuted, and now the consideration is an animal called a pangolin, which is used in Chinese medicine. It's a scaled, it has scales, and the scales are removed, ground up, and is used in Chinese medicine. It's put into a pill, and is often used in Chinese medicine. The genome looks a little similar to that. However, we do not yet know. And of course, there is the theory that there was an accidental, that virus accidentally escaped from the Wuhan Institute of Virology, where they are studying coronaviruses found in bats. That is just a theory. So I don't want you to go away thinking that is the answer. It's just a theory. So how does it spread? It spreads from person to person, and the number of persons who acquire infection from an infected person is about 1 to 4. So one person is thought to affect up to 4 persons, but a median of about 2 persons per case. It's spread via respiratory droplets produced when a person coughs or sneezes and doesn't contain that cough or sneeze, and that the droplets spread, okay, far and wide, and persons nearby breathe that in. It could be from contaminated surfaces, so because you could understand if someone sneezes, someone has the infection and they sneeze or cough, that droplets will fall on surfaces. If I sneeze or cough now, droplets will form on this podium. The next speaker comes up, touches this, then touches their face, then you could easily spread to that person. Virus has been detected in blood, feces, saliva, but the contribution of virus from those places to transmission is unknown, but it's thought to be very, very small. There's mounting evidence that spread from asymptomatic contacts can occur. There are 6 cases in Russia that have been reported that may have transmitted to 6 asymptomatic persons may have transmitted to other persons, but it's mainly, transmission is mainly by persons who have a large viral load. So the theory is that there is viral shedding, so the virus is in the nose, the mouth, and that there can be viral shedding even though a person is asymptomatic. But you could understand that viral shedding is much higher if that person is infected, okay? Because it means then that the virus is in the nostrils, in the throat, and there's some level of irritation, and you have the urge to cough. And when you do that, then you spread the virus. Perinatal transmission or transmission via breastfeeding is possible, but it's thought to be highly unlikely. And I must say here that it's a very new virus discovered in December, and we still don't know a lot about this virus. But up until now, there hasn't been, I know there was some talk about perinatal transmission. I think that was refuted. But there's no evidence of intrauterine infection, and it's unsure, we are unsure of the risk of transmission during vaginal delivery. So all of these things, rest assured, persons are working on. There's great collaboration between universities. University of the West Indies even is on board with research and collaborating with other universities throughout the world. And they are reporting to each other what they are seeing. So we will have a lot more science soon. So how is it spread? We said that if someone coughs or sneezes, and up to 6 feet, if someone is up to 6 feet from that person, then droplets can reach as far as that. So when we talk about social distancing then, somebody's coughing and sneezing, you try to move at least 6 feet, more than 6 feet away from that person. And you can see some of the droplets, some of the heavier droplets are dropping closer by. So those are the droplets that will drop on, like the podium, for instance, if I sneeze, right? Now, if I sneeze, it might reach the Lexan, the smaller droplets, but the heavier droplets would drop closer by. And then the person close by can breathe in those droplets. Persons can sneeze or cough onto their uncovered hands, not wash their hands, then touch surfaces. So it's spread by, I said, respiratory droplets when an infected person sneezes or coughs, from contaminated surfaces, persons touch surfaces, and then they touch their mucous membranes, their eyes, their nose, their mouth. And contaminated hands you transfer to surfaces and to others. For example, when you shake hands or when you hug, for instance. And that is why many persons are no longer shaking hands, but simply giving a nod or something like that, just to, in terms of prevention, just to ensure prevention. The incubation period, so what does that mean? It means once the virus gets into the uninfected person, how long does it take for that uninfected person to show symptoms? And that's about 2 to 14 days with a median of about 5 days, meaning that most persons will show symptoms in about 5 days. But it can range from as close as 2 days to as many as 14 days. Now, how do we diagnose persons who we suspect have COVID? We have to take a thorough history, of course, and we have to listen carefully to what the symptoms are. And I'm going to go through the symptoms. And if they have a travel history. So right now, we have no COVID-19 in Nevis. So if we see someone who we suspect has COVID-19, it means that we have to take a detailed travel history. Or anyone with any flu-like symptoms, take a detailed travel history, a detailed history. And we need to know history of possible contact. So it might not be, maybe they didn't travel, but they are in contact with someone who may have traveled, for example, or in contact with someone who has been in contact with a COVID-19 patient prior to coming to Nevis. Now, how do we determine a case? We speak of cases as suspect cases, probable cases, or confirmed cases. A suspected case is a patient with fever and symptoms or signs of respiratory disease. For example, a cough or shortness of breath. And it's from no other known cause. And that person has a history of travel or residence in a country or territory reporting local transmission. Local transmission means that there's some spread from person to person and not just one contained case in a country. So a country might have one case, but is well contained, and nobody else in the country has it. So travel or residence in a country or territory reporting local transmission during the 14 days prior to the symptoms starting. Or it could be a patient with acute respiratory illness, and that patient has been in contact with a confirmed or probable case in the last 14 days. Or it could be a patient with severe acute respiratory illness, so that's fever and at least one sign of respiratory disease, example, cough or shortness of breath, and requires hospitalization. So what are the symptoms? The most common symptoms are fever in 83 to 98% of patients, cough in up to 82% of patients, and this cough is usually a dry cough, and shortness of breath in about 55% of patients. Also, a lot of patients in the literature are showing fatigue, just really feeling tired. And so that is pretty high up on the list, fatigue and muscle pain. So these are the most common ones that I have put here. In some patients, particularly the elderly and others with other chronic health conditions, these symptoms can develop into pneumonia. So they may start off as just cough, fever, and then they get better in a person who doesn't have chronic illnesses. But in persons who have chronic illnesses, these symptoms can develop into pneumonia with chest tightness, chest pain, and shortness of breath. It seems in the majority of persons to start with a fever, followed by a dry cough. And after about a week, it can lead to shortness of breath, with about 20% of patients requiring hospital treatment. So how do we know for sure if this person who we suspect to have COVID-19 has COVID-19? It has to be done by laboratory testing. So what we do is we take a nasopharyngeal swab, we put it through the nose, as you can see on the picture. We put that swab through the nose, and we get it down to the back of the throat. So we want the nose, we want flora from the nose, virus from the nose and from the back of the throat, nasopharyngeal. Or we can do an oropharyngeal where we put it through the mouth instead and just get the back of the throat. Sputum, we can also use sputum. We can use aspirate, depends on how sick the person is. You can use what we call aspirate or bronchoalveolar lavage, and we wash out the bronchi a bit, the lungs a bit, and we take some of that liquid. So there are numerous ways, but the most common way of getting the sample is the nasopharyngeal swab that we put in. It's a little uncomfortable, but it's not painful, right? So it's nothing to fear. And we put that in viral media, and we send it to the lab. So there are labs that are testing. We have one lab within our federation that is offering the test. So we can get back that result. Once we get it to St. Kitts, we get it back in within 4 hours. And then we send another sample to the Caribbean Public Health Agency lab in Trinidad. So we take 2 samples, and one goes to St. Kitts, one goes to the Public Health lab in Trinidad, because they are doing regional surveillance, and once we pick up any COVID-19, they will report for the entire region how many persons within the region have COVID-19. So we need to send to them also. So a probable case then is a suspect case that we have done COVID-19 test on, but it came back inconclusive. And a confirmed case is a person with lab-confirmed COVID-19 infection, irrespective of the clinical signs. Remember I said that sometimes some persons may have very, very mild symptoms, or they seem like they are asymptomatic. If we test them and they don't have any signs or symptoms, but the COVID-19 test comes back positive, they are a case of COVID-19. How long does the symptoms last? So for mild cases, approximately 2 weeks. So that should be interesting for the persons from Social Security, because those persons will get 2 weeks sick leave, right? Mild cases, approximately 2 weeks. Severe or critical cases would last 3 to 6 weeks. Remember, these are persons who are hospitalized, and some of them are in ICU. And the time from onset to the development of severe disease is about 1 week. So persons can be at home. The reason I have put this slide in is that a lot of persons may be cared for at home. We don't have the capacity to care for everyone in hospital. Mild cases will be cared for at home. You're mild. It's just like a common cold, right? You'll take these necessary precautions, and you're going to hear about those precautions a little later. So persons may be at home, mild illness, but they must, if there's any change in their condition, they must report it immediately. Someone will be checking on them daily anyway, and they must report if there's a change, because it says here that time from onset of the symptoms to development of severe disease can take a week. So you may start out fine, and then in a week, you get severe illness. Among patients who have died, the time from symptom onset to outcome ranges from 2 to 8 weeks. In other words, if the person is very ill, anywhere from 2 to 8 weeks, they can die. Some findings from the first symptom to developing shortness of breath. So a person may be home fine, and then in about 5 days, they realize they're getting short of breath. They can't breathe properly. That is turning into severe illness, and they need to report that, and we can bring them into hospital for care. From the first symptom to hospital admission is about 7 days, and from first symptom to acute respiratory distress, where they need a ventilator, is about 8 days. And remember, those are just most persons. I want to stress, 80.9% of infections are mild. That is what the literature is saying so far, looking at the numbers from the different countries. And the infections are mild with flu-like symptoms, and they can recover at home. And then there are some that have very mild, even very mild symptoms, okay? 13.8% are severe, developing severe disease like pneumonia and shortness of breath, and 4.7 have been found to be critical, and this can include respiratory failure, septic shock, multi-organ failure. In about 3% of reported cases, the virus is fatal, and the risk of death increases the older a person is. So most persons who die are older because their immune system is not as strong as a young person. Relatively few cases are seen among children. Now, I'm going to talk about that a little later. So who are at risk? Who are at higher risk? We said older persons for sure, and persons with underlying illness such as cardiovascular disease, diabetes, chronic respiratory disease, hypertension. However, some otherwise healthy people do seem to develop severe form of pneumonia after being infected with the virus. But mainly it's persons with underlying disease. How are cases managed? There's no specific treatments as yet. Treatments are being studied right now. Supportive care is the order of the day to relieve symptoms. So if persons are dehydrated, they are hydrated with fluids, IV fluids, oral fluids. If they can drink on their own, they're at home, they are dehydrated, you drink fluids. Oxygen and fever reducers. And mild cases, as I said, can be managed at home with daily monitoring. So public health nurses will monitor these patients daily with a phone call, asking, how are you doing? Do you have these symptoms? And if they say yes, then we take it from there, whether or not we need to bring those persons into hospital. So some medications are being tried right now. One that we have here in the Federation is Calitra, and we have Tamiflu. So, and we have stocked up on our stocks of Calitra, so that if in the outer world it's found that these are effective, we would have that available. Calitra is an HIV medication. Tamiflu is a antiviral medication. Darunavir is also an HIV medication. These are what's been trying. And chloroquine phosphate is used in malaria. And all of these are being studied right now to see if they are effective against COVID-19. Vaccines, there are no vaccines available right now. Vaccines is a preventive measure. Vaccines are in phase 1 trials at the moment. So home management. So we said persons who are mild will manage themselves at home. So mild symptoms like low-grade fever, if a person has low-grade fever, cough, fatigue, runny nose, sore throat, those persons will be managed at home. They have no sign, no warning signs, no shortness of breath, no difficulty breathing, no bloody sputum, no increased sputum production, no GI symptoms, meaning no abdominal pain, no nausea, no vomiting, and their mental status is unchanged. They are lucid and they will be managed at home. If they have controlled, that is a typo, controlled underlying health problems, person might be diabetic, hypertensive, but they are controlled. Those persons will be, and they have mild symptoms, they will be managed at home, and we do on daily monitoring. Persons will use fever reducers such as Tylenol, Paramol, and they will be advised to keep hydrated, and they will be monitored for worsening of conditions, and they need to seek help, call ahead. That is something we have been stressing, call ahead before turning up at an institution, because there are measures that we need to put in place. If a person is infected with COVID-19, the nurse has to prepare, the doctor has to prepare, put on the necessary personal protective equipment to treat that person. So it gives us a little time to prepare. Call, these symptoms are worsening, we will tell you come, but we would have the time to now prepare the area for you. And we ask persons at home to practice infection prevention and control so that if there are other persons in the home with them, they don't pass it on to others. For example, use a particular room, use a particular bathroom, and if persons are going to be in touch with them, like giving them their meals and so forth. But remember, these are people with mild illness, so that their meals can be put just outside the door. They can come, take it up, and so forth, and go ahead and eat without anyone getting infected. So it would be most likely your relatives, and nobody wants their relatives to get sick. So we would, of course, coach you and tell you what are the things that you need to do if you're looking after yourself at home with mild symptoms. So what percentage of persons are dying? We said already that about 3%, and so globally about 3.4 of reported COVID cases have died. And I want to pay special attention to that because that is of reported or confirmed COVID. Reported, I should say reported, because it could be confirmed or clinically confirmed, laboratory confirmed or clinically confirmed. But remember, there are some persons with very mild symptoms. So the true number of persons who are infected with COVID, not really known. So how do we work out the fatality rate? So it's the number of persons who have died over the number of persons with COVID. And what we have as the denominator right now is the number of confirmed cases, clinically confirmed or laboratory confirmed, and maybe not the true picture. In other words, what I'm saying is the fatality rate may be lower than 3.4. So what are some of the possible outcomes? Only 2.4% of children less than 19 years are getting COVID, and there are no deaths in children less than 10 years. They seem to have a lower infection risk, and there are a couple of possibilities. Maybe there's cross-protective immunity from the 4 common coronaviruses that I spoke about, those 4 common ones that cause mild disease. It could be that symptoms are just much milder in children than in adults, and therefore we're not even aware that they may have COVID. And their cells may be less hospitable to the virus. so the virus does not multiply very well in their cells. And they may be asymptomatic. They may have it asymptomatic, and can they shed it because they're asymptomatic? We don't know. There was at least one case I saw in the literature where a patient had one of the lungs with pneumonia, and the child was up and about and happy. So they don't seem to show the symptoms like the older persons, and they don't seem to be affected as much or as older persons. But this is something that we have found, and this is something, of course, that the researchers are looking into. So what some more outcomes? Males have a higher death rate than females. Most of the cases are in China. The theory is that maybe the men, because they are heavier smokers, or they smoke more than women, and smoking can lead to respiratory, can affect the respiratory tract. Maybe that is why men are dying and getting the disease more than females. All right, so in terms of death rates, cardiovascular disease is leading the way. Persons with cardiovascular disease are dying more than other persons. Diabetes, persons with diabetes, these are the death rates for persons with underlying illness. Now, in terms of the age group, can't see. So you can see persons who are 80 years and over have a higher rate of death than younger persons. And 0 to 9, no fatalities. So as the age range gets less, younger persons are dying less than older persons, and mainly persons 80 and over. Immune system is compromised. So what's prevention? So how does it spread? We said already, I showed you this slide already, with droplets, right? Persons who are further away than 6 feet, because it's not spread in the air, most likely those persons will not be affected, but definitely within 6 feet, because those droplets are heavy. And we said already, persons breathe in, if you cough on your hands. So how does it spread then? Respiratory droplets, when an infected person sneezes or coughs, and I spoke about this, contaminated surfaces, contaminated hands. We need to practice infection prevention and control measures. We need to get back to basic hygiene if we are to protect ourselves and to protect others. Basic hygiene that we have forgotten about for a while. And it will not only protect us from COVID-19, but it will also protect us from things like gastroenteritis, other respiratory diseases, influenza, and so forth. So we prevent spread then by washing hands, covering your cough and sneeze. And when you cover your cough and sneeze, you have to throw away that napkin into a closed, preferably a closed bin. And if you don't have a napkin readily available, then you can use the flexed elbow so that the virus doesn't, the droplets don't spread far and wide. And then, of course, wash your hands. So we ask persons to prevent themselves and others from getting sick by washing hands often. I know I know you have heard this over and over. I'm going to still repeat it. Wash your hands often with soap and running water. Soap and running water. That process should last about 1 minute. The scrubbing process should last at least 20 seconds, or as long as it takes for you to sing the happy birthday song. If it takes longer, it's even better. If you don't have running water, you can use an alcohol-based hand sanitizer with 60 to 95% of ethyl alcohol. So you have to look at the back of your hand sanitizer to ensure that it has sufficient alcohol in it and it doesn't have anything. Some of them probably don't even have alcohol. So you need to read before you buy, but I don't think you can get any to buy right now. Hopefully soon you'll get some to buy. But those that you have at home, check and see if they have in the correct amount of ethyl alcohol. And it's the same process as washing your hands. And we're going to show you by video how to wash your hands. You're asked to avoid touching your eyes, nose, mouth, so that with your unwashed hands, because you can transfer germs to your mucous membranes. Avoid close contact with people. That is, maintain a safe distance about 2 meters, 6 feet away, particularly those who are sick with respiratory illnesses, not because they're sick with something else, but sick with influenza-like illness. Prevent yourselves and others from getting sick also by staying at home if you're sick, and isolate yourself from other people. So there's isolation at home. Everybody can't be cared for in the hospital. So if you're sick and you're at home, isolate yourself from other persons so that you don't transmit the infection to them. Practice respiratory hygiene. We said cover your nose and your mouth when you're coughing and sneezing, discard in a closed bin and wash your hands. And regularly clean surfaces. I don't think that is something that we do enough of. The fridge doors, the microwave doors, the knobs, the light switches. Clean those, right, with some dilute Clorox, 1 part to 9 parts of water, not raw Clorox. That's not necessary. Lysol, common cleaning agents. So high-touch areas, clean frequently, especially if you're not the only one touching. Even if you are the only one touching, clean frequently. Okay. So now we go to look at the global situation and what is going on worldwide. Video. So as I said, it is spreading globally. In China, that's the epicenter. Wuhan City is the epicenter. The whole of China was affected, some areas more than others. But what you find is the situation in China that is slowing down, right? The infections are really slowing down. So they have peaked, and now they're on their way down. But then there are other hotspots within the world. Oh, video phone. Okay, yes. Okay, so before we bring that video of the global situation, we will bring the hand sanitizing.
So we are going to have some video, a compilation of video presentations and educational and instructional videos. All right, so we're going to change it now, and we're going to do the global. So we're going to do the current global situation first, and then after the videos.
Okay, so what we have done here is to bring you very current what is happening right now in the world. And if Lexan refreshes every couple of minutes, you're going to see those numbers change. So Okay. So far, as of right now, 10:25 on the 11th of March, 1,121,061 total confirmed cases. Hello? So China has the most cases, of course, but like I said, they have been on 80,000 for a while. So they're not moving as they were before. Before, they were jumping from 70 to 71, 72 daily, right? And they have been on 80,000 now for a while. Italy is the other hotspot that is of concern to us. And as you know, there's a lockdown of Italy right now. And that is to contain the spread of the virus. Iran is another place that there's increase in numbers. South Korea, Spain, France, Germany. The US is increasing also, and that number is now 1,039. And I know that is going to get higher because initially the US was not testing as much as they should have because they had a problem with their test kits. But now that they're sorting that out and more testing will be done, we will see a lot more cases daily from the US. Now, in terms of deaths, so far we have had 4,368 deaths. And as you can see, 66,216 persons have so far recovered. The others have not been reported as recovered because they're probably still in the 2-week phase. They still have symptoms. Once it's determined that they are okay, then they will be reported as having recovered. So that number will keep going up. Most of the deaths are in the hotspot in the province of China, Hubei province, with 3,046 cases. In Italy so far, 631 deaths. In Iran, 354 deaths. 54 deaths in South Korea, 47 deaths in Spain, 33 deaths in France, and 23 deaths in Washington, and there are a few other states that have some deaths. So that's not the total deaths for the US. Now, if we come a little closer home, if you come... we have cases in South America, but let's talk about the cases that are closer to us. There are 5 cases when I checked this morning in Dominican Republic, 2 cases in Martinique, 1 case in St. Bart's, 2 cases in St. Martin, French. And 1 case in Jamaica. So that's the Caribbean so far. May have changed, not sure. If you bring down that. So that is what the situation is globally, regionally. Now, in terms of locally, there have been, as of 10/29, on the 11th of March, 2020, no confirmed cases reported in St. Kitts and Nevis. Okay? No confirmed cases. So in terms of measures that are in place, things that we have been doing since so the Disaster Mitigation Council was activated, and a number of stakeholder meetings have been held with representatives from NEMA, the Nevis Disaster Management Department, and other stakeholders. Health, for example, sits on the Disaster Mitigation Council. We have had international health regulations, national focal point meetings. That is a health group, because we have signed on to the international health regulations, and therefore we need to meet regularly, but we have been meeting very regularly recently, and we have been revising the pandemic flu plan to include COVID so that we can put it out to the public. And so shortly you're going to be able to access that pandemic. Surveillance has those hotspot countries that we have seen there. We have had training and sensitization of healthcare workers, and that is ongoing in clinical care, in infection prevention and control, and in contact tracing. Because if we find one case, we have to trace who that case may have been in contact with. We have implemented the communication strategy, and this is part of that strategy, this symposium. And we have identified, we are in the process of identification and preparation of isolation and quarantine areas, bearing in mind that most quarantine will be done at home and most persons will be isolated at home. If we need other sites, we are in the process of identifying those sites. Thank you very much. The idea was not to bore you with such long talking, and that there should have been some videos in between, so you can have the videos now.
I'd like to thank Dr. Nisbet for the very educational and informative presentation. Can you have a round of applause, please? And it was not boring, Dr. Nisbet. It's very educational. So now we will have a series of videos, video presentations, and these videos, they're both educational and instructional, and they can also be found on our Facebook page and our Instagram page even after the symposium today.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe. Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Once dry, your hands are now clean and safe.
Stop the spread of germs that can make you and others sick. Cover your nose and mouth with a tissue when you cough or sneeze. If you don't have a tissue, use your elbow. Wash hands often, especially after coughing or sneezing into a tissue.
Okay, that has been our video presentation. So now we are going to move on to measures at the border. So you should be hearing from NASPA, and I would like to give a special welcome to the Nevis Air and Seaport Authority, as they are one of our major partners in this whole coronavirus and also with other strategies and mitigations that we have. So welcome Mr. Mikhail Manners, and he's going to give us NASPA's presentation.
Morning, everyone. Michael Manners, NASPA. I'll be briefing you on the measures taking place at all ports. I'll start by naming the ports that we are currently managing. That will be Van Sammy International Airport, Long Point Deepwater Port, Owali Pier, and also Charleston Port. What are we doing to protect the border? We began with education, procedures, increased security, and those are the areas, and increased collaboration. Those are the areas that we are going to tackle throughout. We started with posters displaying health information provided by the Health Promotion Unit. They have been erected throughout all ports, mentioned before. The slides are just going to have pictures. I'm going to talk. You're going to have the pictures to have a better understanding. All port-assigned televisions are displaying health promotion videos at a rate at 30 seconds. This information is strategically placed in high-traffic areas. Airport check-in, departure lounge, arrival hall, VIP lounge. I'm specific with certain information because if you haven't been at the airport recently, you will have doubts. I want to assure the public that these measures are in fact in place. Other areas we're displaying information on monitors and posters, Long Point and the Charleston gazebos. In terms of education and additional procedures, we have created a port-specific checklist. This checklist has been implemented across all ports. Obviously, it's port-specific. This is just an example. These checklists allow for seamless transition in the event that there's a suspected case. Basically, whether it's Tom, Joe, or Harry, they'll know exactly the procedures and who to contact. Multiple agencies have been briefed to include Customs, Immigration, NASPA Security, the Airport Police Task Force, Airport Administration, and all airline agents operating at the airport. Although all agencies listed above might not use the specific checklist, we felt it necessary for them to familiarize themselves with to ensure continuity and collaboration. All agencies throughout the Nevis ANC Port Authority have been issued information packets. As we said, we're trying to educate people at the port. They need to be calm when you're traveling through it. Information packets, gloves, masks have been issued to all agencies on the port. Training has been provided to all agencies on identifying symptoms, necessary precautions that should be taken, and actions to be taken. In terms of additional security, we have had meetings and discussions with the following agencies: Customs, NASPA Security, and the Airport Police Task Force. Security has been beefed up at all ports in assisting all health officials in providing the support needed to carry out their screening. Yes. Oh, that's a picture of the nurses at the airport, just in case you were wondering if it's true. Yes. As a customs officer as well. As I said, customs, security, and the police force are on the airport and they're observing. I encourage everyone to support the nurse. Don't be troublesome. They're there to protect you. Well, me as well. Ports have been outfitted with additional hand sanitizers throughout. We do understand that washing your hands is still the most effective measure of prevention, but we felt it necessary to install as many hand sanitizer stations as possible across the port. somewhat of a secondary line of defense if it's not feasible to wash your hands at that time. Health offices, question and quarantine areas have been allocated for health officials stationed at various ports. Health officials are also outfitted with the necessary restricted area passes to allow them free movement to perform their tasks. Please be advised that the health officials and nurses, they're not only on the arrival, they'll be throughout the ports, monitoring all passengers. We're gonna go to more, let's go with the slide. After each arrival at the, hold on, let's go back to that slide. After each arrival at the airport, cleaning technicians in conjunction with the customs office, we sterilize the area. That's the arrival hall, departure, the entire airport. Once there's an arrival, they go through doorknobs, any surfaces that anyone comes in contact with, it's sterilized after each flight. Next slide. I'm going to go to specific port information. Everything mentioned before is across the board, but in terms of Awali Pier, we have increased patrols by security and marine officers. We know that yachts tend to dock outside, so we want to ensure that there's security too, that they have the right documentation. At Long Point, okay, Charlestown. At the Charlestown port, all incoming traffic arriving at the Charlestown harbor is subjected to health screening. This includes yachts and cruise passengers. Please know that there is already standardized procedures in relation to receiving passengers to our island. There's a boarding crew consisting of customs, immigration, NASPA, security, and health that evaluate the current status of passengers before allowing them to disembark. If passengers are allowed to disembark, they will still be required to go through a health screening at the Charlestown port. Areas have been identified to conduct these screening procedures. We have identified certain areas where yachts may disembark. Oh, you go ahead, next slide. Yes. We have identified certain areas where yachts may disembark, or yachters, sorry, may disembark their vessel outside the registered ports such as Pinnis Beach, and have collaborated with the Ministry of Tourism to equip and train beach patrol officers to combat this possible threat. All international passengers disembarking yachts or any other vessel must present a declaration of yachts, a receipt indicating the previous or NASPA receipt. This will allow the security agencies to verify that they have been screened by our local health officials. Once again, I'd like to emphasize that all passengers, all international passengers coming into our shores will be screened. There will be no exceptions. And I think that's it for me. Thank you.
Thank you. Thank you, Mr. Manners, for your presentation. I'm sure a lot of us feel a little bit more relief, right? After seeing some of the strategies they have in place. Okay, next we will hear from our medical response, and Dr. Nisbet will, okay. So we will move on to the video presentation on the use of masks. Okay, we're having some slight technical issue with 1 moment.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive or soap and water. For more information on mask use, other preventive measures, and the new coronavirus, check WHO website at who.int. Thank you.
And now we'll have Dr. Nisbet give the presentation on infection prevention and control.
I'll speak very briefly about infection prevention and control. The designated speaker could not make it, so I'll speak a little broadly about infection prevention and control in terms of the hospital setting or the health center setting. These are control measures that we have in place to prevent the spread of disease within our health facilities. There are also measures, of course, that we discussed earlier that we ask persons to put in place in their homes and their everyday life, such as washing their hands and so forth. But in terms of the clinical setting, we use clinical triage so that we can identify early patients who are infected and to control that source of infection. So if we are able to identify the patient early, it means then that we can quickly isolate and prevent further spread of disease. So that is one of our measures. Of course, we use standard IPC precautions for all patients at all times. And some of those standard precautions are to wash hands, to always practice respiratory hygiene, to prevent needle sticks by using your gloves, prevent body fluids from you getting infected from other person's body fluids, and to always take care of the waste appropriately. So good waste management, environmental cleaning, and sterilization of patient care equipment and linen properly. So those are standard things that we do all the time. Now, in a case of acute respiratory infections, there are some additional precautions that we take. So we offer a mask, as you could see, that the video said, offer a medical mask to patients if they are coughing or sneezing. And the healthcare worker can protect themselves also by using personal protective equipment, which would include a mask, a gown, gloves, and so forth. So once a patient then turns up at hospital and we can quickly isolate, and I want to emphasize quickly isolate, and that is one of the reasons we ask persons, if you have respiratory illnesses, even in the flu season, even after COVID-19 has passed, you have respiratory symptoms, call ahead so that persons can prepare for you, so that you don't come into the waiting room, for example, and spread to others. So we can quickly identify persons, separate them, and offer them the necessary mask. We will also be limiting the number of healthcare workers, the family members who are coming to visit, and so forth, if we have a patient. So we have set staff. We will have set staff for that patient. So it's not every nurse and every doctor in the hospital would take care of the patients, but we would have particular healthcare workers who would be adequately donned in their protective equipment while they take care of these patients. One of the things that we ensure when we are taking care of acute respiratory infections is to ensure that persons are at least 1 meter away from each other if they are in the same room. And in cases where it's possible, we use ventilated rooms, rooms that air can flow through. One of the other things that we want to be implementing and soon is if we find we start having a lot of cases of respiratory illness, to identify a particular place where persons can be channeled, and that is basically what we call a flu clinic, so that persons who are going to that area have care in that area rather than going into a main area where everybody else, where the cardiac cases, the heart attacks, the stroke patients turn up, the everyday persons turn up at the main outpatient department. Once we have increasing cases, we will have to find an area for just respiratory symptoms. So that is a quick overview of what our plans are, and to assure you that the necessary infection prevention and control measures are in place, and that we have stock in place, and we have ordered additional stock. Thank you.
Thank you, Dr. Nisbet. Now we'll have a presentation on the contact tracing and quarantine, and that will be presented by Dr. Retna Walwin. I also want to inform you, in case you didn't know, you can save your questions, and we'll answer after we finish the last presentation, in the event that you do have some queries and concerns.
Good morning, everybody. I know we've had quite a few presentations before, and my presentation shouldn't be too long, but it is one of the important presentations for today. You would have heard from Dr. Nisbet and from Mr. Manners, and so my presentation is basically to stress a little bit more about isolation, quarantine, and contact tracing, which are important public health measures that will affect you as individuals and you as a community. As you would have heard before, we have certain measures in place to quickly identify persons or to screen persons, and so with the information that we gather during those processes would categorize persons and more or less channel them into whether we would have to isolate or quarantine, and then thereafter contact tracing. So I hope you are able to get some information from my presentation. So recently, and as Dr. Nisbet would have mentioned, the Federal Ministry of Health has been putting out travel advisories. And I put up a slide here, more or less, to highlight you to a part that, that is important in the press releases. This one is from the 9th of March, and as the situation progresses, we would have further press releases and we would have further travel advisories. So in this advisory, you would see that there are a number of countries listed, and as mentioned before, these are key countries, these are hotspots, these are areas where you see you have the number of confirmed cases and an increased number of deaths. And so the part that is underlined, you would see that once you come to our port, you will be monitored and you will be quarantined at home or to a designated facility based on your risk assessment. So this, in a nutshell, is a schematic presentation of what happens when a person comes to the airport or whichever port. There's a risk assessment done, and as Mr. Manners mentioned, he more or less highlighted what is being done. This is a group of persons who go and do this initial assessment, and according to the certain criteria, we determine whether that person is high risk or low risk. If the person is high risk, then of course they would have to be quarantined, and here we stress a government-assigned facility, and then if the person is low risk, then we may consider home quarantine with supervision by the public health department. So quarantine and isolation, like I mentioned before, are important public health measures to prevent, delay, or reduce human-to-human transmission. And Dr. Nisbet would have gone through how this disease is spread, and so this is the basis for isolation and quarantine. It helps to protect the public by preventing exposure to people who have or may have a contagious disease. When you hear of quarantine, some people say, well, is quarantine the same as isolation, or isolation the same as quarantine, because you are separating people. Quarantine is basically separation of well people, meaning that you may have been exposed to this infectious disease and you are still well. You don't have any symptoms as yet. And so we need to separate you, we need to put you in a way because we are not sure what's happening with you. In isolation, this is separation of sick people, meaning they may have had a contact and now they're presenting symptoms. So a person can start out in quarantine and then end up in isolation. You may say, well, okay, I feel fine, and what's not? Then, as Dr. Nisbet would have shown you, there may be a period of time where you feel well, and then as time goes by, you start to develop symptoms. So at one point, you are in quarantine, you say you feel well, you don't see the point of this, and then the next day, your temperature starts rising, and then we will have to isolate you. Now, isolation and quarantine is actually a legal function. Dr. Nisbet would have mentioned about the International Health Regulation National Focal Point, and here I mentioned the International Health Regulation of 2005, which are a number of guidelines that member countries would have to adhere to. And the legality of it has to do with the fact that the country has a right to do the necessary to protect its citizens. It has a right to act in the benefit of the country. And so therefore, when we are faced with health situations such as infectious diseases and such as coronavirus, as this COVID-19 outbreak, we need to act in the interest of the public. And so quarantine and isolation is named, and it's actually listed in our Public Health Act. And recently, up to the 21st of February 2020, there were some amendments, and now we have the public health quarantine regulations that will be enforced. So that gives more or less health, security officers, enforcement officers, the right to intervene or interact and assist with ensuring proper quarantine and isolation measures are carried out. So you can check your legal department for a copy of that so that you can review that information. So I'm just going to go through some of the things that we have to consider from a public health perspective and what you as citizens or persons have to consider when you hear of quarantine and or isolation. In the case for coronavirus, for now, we are saying the quarantine period is for 14 days. So once you have been ordered to quarantine, you will not be able to leave that quarantine until 14 days after. Possible settings, it can be at your home, it can be at a hotel and dorm. So as would have been mentioned before, the situation is changing, the epidemiology of the disease is changing. If there are new information, that would determine whether these 14 days would apply in the future. Also, depending on the situation, I mean, yes, we may have guidelines, but then life happens, situations arise that you may not think about, and so we may have to make the best decision as to where may be the best site for quarantining individuals. We have to communicate once we give that order. in terms of how long you're going to be staying, what it involves, how we're going to monitor you, what will happen if you have symptoms, and how it relates, to, particularly if you're a visitor, how it would how it affects your traveling, and so we would have to make some sort of contact with embassies and consuls. We have to take into consideration as well transportation. Of course, you don't want to have somebody who may have been exposed jumping on a bus or just calling a taxi and say, well, okay, I feel kind of sick, so I'm just going to call a taxi and get to the hospital. So we need to have that outlined and discussed with the person who has been ordered to quarantine. We have to consider accommodation and room and accommodation arrangements. You may have a partner, you may have other family members, and so we need to make sure that you have a place that is separate and apart from other family members. So that's something that's priority on the list, because it doesn't make sense to say we're going to quarantine you when there's one room and everybody is staying in that one room. Communication with family members. You will be away from family and friends, and so of course there must be some channel by which you can get information to your family, and we as public health officers would be able to relay what's happening with you during that time. Waste management. Again, we're dealing with infectious agents, and so there must be a designated area, there must be a point, a collection point, and we must say how we're going to collect it, how often we're going to collect it, and how we're going to dispose of this waste. Arrangement for persons with special considerations. Again, you don't know who might be identified. This person may will have a chronic disease, some other illness, may have some disability. And so, again, it depends on the individual situation. We have to take into consideration how we're going to move around that person, how are we going to get access to that person, how are we going to deal with other conditions. Yes, you may be isolated. You need to have contact with the outside world, so access to entertainment, some sort of way to pass the time, whether it's through using the internet or books or magazines, but that should be considered as well. And of course, psychosocial support. Being in isolation or quarantine is very traumatic. It's frustrating. It can have an effect on not just the individual, but as well the medical staff, the team who have to monitor and manage these quarantine sites. So these are a lot of things that you as a person have to think about ways in which to cope with the situation, as well as healthcare workers. Okay. So in terms of specific infection prevention and control measures, that would have been listed by Dr. Nisbet previously, and the same applies. You have to ensure a safe environment. You have to implement standard precaution for both persons quarantined and health personnel. And so a healthcare worker cannot say, well, okay, I'm monitoring and just show up at the house. They too have to be prepared. They have to use their necessary PPE, relate the information, say when they're visiting, and of course protect themselves. And the person who's being quarantined, they too have to take consideration of anybody else who may come into their contact unknowingly. So let's say you're in quarantine and a neighbor said, well, okay, I want to come and see you. Say, well, okay, I'm sorry, I can't have you visiting because I've been instructed to stay at home, and so I don't think you should bother to come. So these IPC measures, of course, include hand hygiene, which are the washing with soap and water, respiratory hygiene, cough into a tissue, sneeze into a tissue and discard of it. If you don't have a tissue, sneezing in a flexed elbow. And no touching of mouth and nose. That's something I know is a little difficult because we inadvertently touch our face, and here I am moving my hands and everything and picking our nose and rubbing our eyes, and we don't think about it. So we have to get into the habit of not touching our mouth and nose. And of course, ongoing IPC education. Of course, these are habits. Healthcare workers may be a little bit more aware of it and may practice it more, but for other persons, it might be something new for them. And so, you have to keep sharing this information and emphasizing the need for infection prevention and control. I have here medical masks not required for persons without symptoms. So if you are at home, like I said, and you don't show any symptoms, once you're in these areas, you may not necessarily need to wear a medical mask. But as you saw in the video previously, for any particular reason, if you have to come in close contact with somebody who you know who is in quarantine, of course, you would have to use some protective measure. Okay, so as it relates to environmental control, again, continuing clean and more cleaning. Regular and thorough cleaning during the quarantine period. You would clean and disinfect frequently used surfaces, clean and disinfect the bathroom, clean and wash towels, bedclothes, bath towels, anything more or less you have to keep clean. And of course, use disposable gloves. When it comes to health monitoring, this is on a daily basis. Like I said, the situation can change from one case of being asymptomatic to symptomatic in a matter of hours. And so our healthcare team would have to check in with that person daily. And we assess for symptoms. We go through a list of symptoms, as Dr. Nisbet would have mentioned. And of course, we have to get a body temperature. As you would have seen from the presentation, fever is one of the most common signs and symptoms, and so we have to record a temperature on a daily basis. Some persons may just have a slight increase in temperature. That in itself can be a warning for us. And of course, special consideration and additional screening in persons with chronic conditions. You have to think of that elderly person who would need their medication for diabetes, for hypertension, a person who may have asthma. What happens if they have an asthma attack while they're in quarantine? All these things we would have to prepare for. And of course, during the assessment, it's important to get that information of pre-existing conditions so that they can put in place so that everything can be available if necessary. And then laboratory testing. Here I have at the end of quarantine, yes, when you're identified, you would or should have a test to say whether you have the disease or not, whether you have symptoms or not. And well, if no symptoms during that period, you would still have to be tested at the end of the quarantine so that we ensure that you are not actually carrying the virus before you are released. Now, home quarantine, like I said, in some situations, we may ask the person to be at home. Again, this might be a dorm for students or even a hotel room. And like I mentioned before, no visitors, and your activities outside are completely restricted, meaning you can't go to the party, you can't go outside to meet with a friend and have a chat. You're basically confined to your home. You cannot use public transportation, and of course you separate from people. And I mentioned animals here, even though there hasn't been evidence of persons infecting their pets as yet. It's still mentioned that you should try to be separated from your pets at home. You should be in a well-ventilated single room and avoid sharing household items. So this may seem repetitive, but again, it's all about prevention and personal hygiene that cannot be overstressed. Home quarantine, clean all high-touch surfaces. Again, monitor your symptoms daily and call ahead if you find, you feel okay and you notice something different, you feel a little more tired than usual, or you feel like you're developing a fever even after you've been checked by the healthcare worker, then of course, we advise that you call ahead, you inform that person who is assigned to you or that person who is collecting your information on a daily basis, let them know what's happening, and prepare for transportation to the hospital. And of course, strict infection prevention and control measures. Okay, so when do we determine that you can leave isolation or quarantine? That is on a case-by-case basis. Again, it depends on your clinical presentation and your lab results. And so this is discussed with the clinical care manager, and of course, this has to be informed. The chief medical officer of health would have to be informed of when these persons have actually been released from isolation or quarantine. And this would be given if, in general, there are no symptoms after quarantine and the laboratory tests are okay. So just a bit on contact tracing. Again, this is a key public health control measure for communicable diseases, and it's used to identify close contacts of a confirmed case. Close contacts broadly are persons who within 6 feet of a COVID-19 case for a prolonged period of time, or persons having direct contact with infectious secretion. So that's if somebody sneezed and you were just right there and that person sprayed their air droplets on you. Or you can even go further and say that you were in contact with somebody who was in contact with somebody who had who was confirmed to have the coronavirus. And so the importance of contact tracing is to reduce, of course, transmission. Close contacts are at higher risk of becoming infected and potentially infecting others. And so by contact tracing, we help contacts to get care and treatment and thereby prevent further transmission of the disease. So as you can see from the picture there, one person can be in touch with so many persons on a daily basis. And so this is very vital, this is essential in terms of control and reducing the spread of any disease. So for our public health officers, most likely would be nurses and our public health teams. There are 3 basic steps. You have to identify that person, list those persons, and of course, follow up. When you identify, yes, we will have to ask you questions. Where have you been? Not that we're trying to get your information, not that we're trying to be fast or anything, but we need to know who you are in close contact with. And so we, of course, would like you to be upfront and be quite truthful in delivering this information. And once we get that list, of course, we have to reach out to these persons. We need contact numbers. We need to know where we can find them so that we can approach them and do an assessment and then determine if that person would need to be quarantined or isolated depending on the case. And of course, contact follow-up. We have to follow that person, again, for the period of time until they're asymptomatic or until they've been cleared or until they've tested negative. So quarantine of contacts, again, the persons are required to stay in that designated point, no visitors allowed, no use of common facilities, security measures may have to be in place, and this applies across the board. Some persons might be resistant, and so you may have to go to certain extremes to ensure compliance. Daily cleaning and hygiene practices are required, and daily health monitoring. So my key points that I want you to take away is that in isolation and quarantine, contact tracing is a must. This is something that we have to do, and so we encourage you to work with us, be truthful, don't see us as being fast or trying to get in your business or just bothering persons. No, it is a matter of protecting our communities. Again, quarantines for well persons and isolation sick persons. Please adhere to our measures implemented and follow the advice once that information is available. And of course, don't panic. I know there's a lot of information out there. This is an opportunity to now understand what is happening, what it involves, and so make your decisions based on the science, based on the data, and of course, we are always here to answer your questions and concerns, and we look forward to hearing from you. Before I go, this is just a graph that I put there for your attention, and thank you.
Thank you, Dr. Walwyn. We will now be hearing from Mrs. Nadine Carty-Keynes about the communication strategy.
Good morning, everybody. Okay, so from the Ministry of Health, Health Promotion Unit, we've been trying our utmost best to get information out to the public. And of course, we welcome any suggestion, feedback on how we can improve this, as communication is an ever-learning process, and we are never perfect at it. So with that said, we would have started some communication in terms of the coronavirus, as it was called at that point. Now it's called the COVID-19, and that would have started around the last week in January of 2020. We have partnered with Mr. Colin Tyrrell of CityCom Advertising Network, and he have offered that service for free, as he in turn thinks this is not just about him and his business alone, but it's a community effort. So we would like to applaud him for that. Thank you. And that is why NASPA can have those ads running every 30 seconds or so. We've also partnered with other persons that you've heard throughout the presentations this morning. We've had a series of PSAs, which are public service announcement. We have audio versions, and we have video, and those are on NTV8, radio, our Facebook page, Health Promotion Nevis Facebook page, our Instagram page, our YouTube channel, and the NIA website. We also have our programs, which Health Matters, which are aired on Mondays, and on the Healthline news, reviews, and updates, which are aired on Wednesdays on NTV8, and it's also shared on our Facebook and YouTube channels. As you know, Dr. Wong would have mentioned travel advisories. Those would have been issued from the Federal Ministry of Health. We have had announcements at the sporting events. This is nothing new. We've done this every year. We encourage persons to wash their hands, cover their cough and sneeze, etc. at sporting events. And we partner with the Ministry and Department of Education to get that done, and that continues for this sporting season. Sanitization letters to businesses, churches, etc., to encourage and promote hand sanitizing when water and soap is not possible. So for those persons who have not seen that yet, kindly have hand sanitizers. Kindly have hand sanitizers available in areas where customers and employees have access, and to encourage the proper techniques. You would have seen a video on how to use a hand sanitizer. It's not as drop it on your hand, give it. So, yes, we're back. We are also doing a series of sensitization sessions. This is one. We've also done sensitization in the schools. We've started with the high schools and the primary schools this week, and we'll be doing the preschools and nurseries. And we've also had consultations with various stakeholders. We've had sensitization sessions with business places, at churches, and at schools. And we're also not forgetting our Spanish-speaking community. We'll be doing those sessions with them also. To continue our sensitization, we will be having a series of town hall meetings. So listen out for those dates and the areas where they will be held. We have produced various posters. Now, we have not created our own. It doesn't make any sense. We have to work smart and fast. So we've used posters developed by the World Health Organization and CAFA, which is our Caribbean Public Health Agency. So we have not recreated the wheel. We've just used the information provided by these agencies that are reliable information is given. We have presented various posters on what is COVID-19, the transmission, prevention, treatment. We have some out about the myths. You have to know what the myths are so that you can dispel them. These posters are seen around. They're in certain business places. Some persons have come and collected from the office. We have them at health facilities. We have them in schools. We have them at certain key points. Mr. Manners would have mentioned that NASPA would have collected a series of them. And we welcome persons to come to the office and collect if they so desire. And we also have some outside at the entrance, so when you're leaving, you can also collect. We have Facebook postings on our Facebook page, Nevis Health Promotion Unit. You can go on there. We have posted WHO, which is the World Health Organization, and CAFA's situation reports. These are found daily. They give you a situation report about the global situation with coronavirus, COVID-19. We have posted our federal press releases that is provided by the Ministry of Health, and federal press conferences and WHO press conferences. We've also had talks on the radio, and that will continue. And we've also had presentation with Nevis Newscast or NTV8. And of course, we'll do some pop-ups at workplaces for persons who did not get the opportunity to be here today to attend any of these sessions. We'll do short pop-ups at different workplaces, bars, restaurants, etc. Wherever we think people will congregate or may be and we can share the information, we'll try our utmost best to be there. And we've also shared videos on hand washing, cover your cough and sneeze, the use of masks, hand sanitizer use, and other information. We've also sent information via WhatsApp, and if you look when you enter the building, you'll see some posters with QR codes. We've put them there so that you can use your phone, grab the QR code, and it will take you to the reliable sources where you'll find reliable information. And I'm stressing reliable because you'll be given all kinds of information, but we want you to stick to the WHO, the CAFAs, the CDC to get your information. And of course, the Ministry of Health here in St. Kitts and Nevis, we are also a reliable source. Promotional materials from Health Promotion is available. They're available and we're willing to share with anyone. And we welcome any partnership, any suggestions. And we've also had recently the Honorable Timothy Harris media release on coronavirus. And we also have a focal point who sits on the CAFA Regional Health Communication Network, which also looks at different ways of getting information out and collaborating and sharing information. We are one Caribbean, and we need to protect each other. So do your part, and we'll try and do our part. Wash your hands, cover your cough and sneeze, use hand sanitizer when water is not possible, and then make sure you get to soap and water, right? And make sure you provide the soap, the water, and the paper towels so that those measures can be done effectively. Thank you so much. That's part of our communication strategy, trying to reach everyone, everywhere, the highs, the lows, as much as possible. And we welcome any feedback, any suggestions. Thank you so much.
Thank you, Mrs. Nadine Kati-Kane, on your presentation about our communication strategy for COVID-19. Next, we'll have Mr. Brian Dyer, who will be presenting on disaster management. Welcome, Mr. Dyer.
I stand between lunch, so I'll try and get out your way as quickly as possible. My role as disaster management plays a critical role in managing all disasters, or managing all hazards. So we are like a big brother to the Ministry of Health as they prepare for the impact of COVID-19. Next slide. The role of disaster management it covers an all-of-government approach, or whole-of-government approach, in that we're responsible for preparedness, response, mitigation, etc., with regards to the disaster management cycle. We are also responsible for dissemination of resources, managing our resources as best or far as practicable to ensure that it is equitably shared to persons in need. Next. No, go back. All right, this is the disaster management cycle. It is broken down in 4 major areas: preparation, response, recovery, and mitigation. Currently, we're in the preparatory phase. That's before the first case is noticed or recognized on St. Kitts and Nevis. All right? So there are a number of activities that are going on in partnering with our stakeholders, not only the Ministry of Health. Disaster management is a function of the national security. So some of the information coming into the Federation flows through disaster management. Sensitive information, that is. All right? Go back to the disaster management cycle. It is critical that we pay specific attention to the disaster management cycle. The preparatory phase is very important, but also the response mechanism. We traditionally would have 2 weeks period for our response. The response period is a period where we try to minimize the suffering. But because this is a health issue and the quarantine and isolation period and the incubation period also is outside the 2-week period, this is something that would have to be flexible in this scenario. The recovery, we have specific measures in place for the recovery process. Dr. Walwyn mentioned psychosocial or psychological support that is also embedded within our recovery process. All right, next slide. All right, these are a number of hazards that we have to manage. It's a bit much, and the health hazard is no different. All right, next. Disaster management structure. I've included this slide because some persons think that the disaster management team that we work at the office is the only entity or the limited resources we have. But this is not so. All right, next slide. This is the disaster management structure. It entails the Cabinet of Ministers, the Premier, Deputy Premier, the Disaster Management Committee, the Permanent Secretary of Disaster Management, Assistant Permanent Secretary, we have the Director, then we have the 11 subcommittees. The 11 subcommittees are chaired by Permanent Secretaries and heads of government departments. And under the Director at the Nevis Disaster Management, we have the Director Disaster Management staff, we have persons in the districts or parishes, and our volunteers. All right? The Nevis Disaster Management Committee is equivalent to the National Mitigation Council on St. Kitts, which makes decisions, or hard decisions, with regards to our impact and our response mechanisms. The Director of the Nevis Disaster Management Department sits as the Secretary to the Nevis Disaster Management Committee. However, in the absence of the Minister on a PS, that role of chairing that committee goes to the Director as well. All right? And if you look at the committee, it covers all the government departments and ministries. All right, next. In the event that the emergency response or the Nevis disaster management is activated, or the EOC is activated based on the instructions of the Prime Minister or the Premier, this is the setting that will be applied at the office, where we'll have the incident command system being played out. The incident command system is made up of the executive group, the Cabinet of Ministers. There's a room specific at the office for the Cabinet of Ministers. Then we have the incident commander, who is responsible for this, who has with him safety officer, liaison officer, and a public information officer that is responsible for getting information out to the general public. The general staff is made up of persons who will fit the operations, logistics, planning, administration, and finance. In some instances where there's a special situation, we may have to launch an investigation. So a special group is created in that event. All right? The general group is manned by, again, members of our government infrastructure, permanent secretaries and heads of department. Next slide. Some support system that we have done so far, we have met with our stakeholders. I have also recently provided the Ministry of Health with a table of exercise that they can review, and we will have that rolled out sometime in the near future. In the worst case scenario, we have 24 shelters on the island of Nevis. And whenever we have an emergency or disaster, these shelters come into play. We usually request persons use the buddy system and stay at home or shelter in place, right? It is being stressed by the Ministry of Health. However, in the worst case scenario, we have identified the Charles Waters Community Center at Hanley's Road and the Ponnell Community Center to assist the Ministry of Health in the event of a widespread impact, all right? When these shelters are operated, disaster management is responsible, or the disaster management framework gets into place. We're responsible for feeding, security, etc., etc., etc. So we hope we don't get to that stage, but in the event we have to go to that route, disaster management infrastructure will come into place. We have a quantity of PPE suits at the department that can be used to supplement the Ministry of Health, and also the persons who would be inspecting the isolation centers. Psychological support is important. We have been proactive, and a number of persons have been trained, not only in the Ministry of Health, but also in the Ministry of Education and the Social Services with regards to psychological support. The doctor mentioned that it is critical that persons receive such attention when they go into quarantine, etc., etc. Persons would also be traumatized because of the long period they may be away from work. So it is important that that arm of the Ministry of Health and the other departments get in gear. All right, next slide. The disaster management, or St. Nevis, is part of the CDMA, or the Caribbean Disaster Emergency Management Agency mechanism, what we call CDMA. All right, we are one of 18 participating states, and there is a structure in place in the event that our resources are overwhelmed. All right, next slide. St. Nevis sits in the eastern sub-regional focal point area, which is governed by Antigua. All right, I don't know if everyone has seen this. And within this sub-region, we have Anguilla, Montserrat, St. Nevis, and Antigua. St. Martin has recently made an application to CDMA, so they should be joining the eastern sub-region very soon. All right, but there are other sub-regions across the Caribbean. Next slide. All right, for triggering the mechanism, in the event that St. Nevis becomes overwhelmed with the impact of COVID-19, we have a loophole where stand by for questions.
Thank you, Mr. Dyer. And so now we have come to the end of the presentations for this session of the symposium. Please give our presenters a round of applause. And we would like to invite all of our presenters to the stage to answer any questions that you may have. If you have any questions, when they are seated, you could raise your hands, and one of our staff members will bring the mic to you so you can ask your questions. So please give us about 2 minutes. Okay, we are now open for questions.
I'm going to start the ball rolling on this bit right over here. A very pleasant good day to everybody. I must commend the panel on their presentations. My first question is for Mr. Manners. That's customs and, okay. You spoke about the 4 ports of entry. The airport, the pier at Uwali, Charlestown Pier, and the Long Point Pier. But I didn't hear anything about the Sea Bridge, which is a very, very, very crucial and important point of entry. So if we don't catch them at those 4 points, what about the Sea Bridge, where a lot of people enter? That's my. But I'm going to hear from Mr. Manners.
That's a very good question.
Okay.
I named the ports that we are managing right now. Seabridge is not managed by NASPA. We also don't have a confirmed case in the Federation. We must understand there's screening at all ports in St. Kitts as well. The Seabridge only goes to St. Kitts, so there's no need for surveillance there at this time.
But at the same time, we are talking about Nevis, port of entry, whether it's coming from St. Kitts or...
Seabridge is not considered a port of entry. A port of entry would be Long Point, Charlestown, and the airport. We increased at Owali, security at Owali, because of the possible yachts that there's mooring out there. So just in case, for instance, same thing we did at Penny's, just in case yachts don't clear customs and they want to come on the beach for lunch, have a drink before clearing customs, and that is very rare. But just in case they try to do that, we wanted to increase security at those areas to ensure that they have the necessary customs declaration or the NASPA receipt to show that they have went through screening at the Charlestown port. But port of entries are based on international. Once it's just between the Federation, we're Federation. And there's screenings at all port of entries in St. Kitts. I'm assuming that.
Well,
yes, it is. Yes, it is. That was a light moment. That's a light moment. Yes,
well, let's hope that nothing slipped through there, but I'm not convinced that we can't have seepage or spillage or coming through there. That's me. That's my...
I agree.
That's my opinion.
I hear your concern, and I will take it to the necessary personnel, and we'll look at it again.
Yes, it's a concern.
Yes, we will look at it.
Okay. Do I continue with my next question? Okay. This question now is for the health. Dr. Nisbet, our nurses are at the point of entry, first contact, and I'm wondering, when I look at the television and I see the way the first responders, the frontline people are dressed, we don't see their faces, we don't see their hands, their feet, we can't see anything. I'm wondering, just wondering if we are prepared, getting prepared for that type of protection for our healthcare workers, especially first point of entry, first contact.
Okay, thank you for that question. I understand your concern because of what you're seeing on television, but we follow guidance, World Health Organization guidance, and it is from that guidance we know that it is not necessary for nurses to be donned like that in what we call, quote-unquote, PPEs that look like spacesuits. That's what you're talking about? Right. So we have the appropriate personal protective equipment at the airports. They have sufficient supply for when they need to use it. So they know the circumstances under which they need to don their personal protective equipment, and they have the supplies to do that.
Okay, thank you. Thank you very much. One other question. Quarantine. I'm just asking, do we have any designated sites that we are working, towards preparing for quarantine? Because we talked about maybe the hotel or somewhere, but I'm just asking if we are in preparation, in preparation mode for any designated area for that type of thing.
Okay, thank you again. In our presentations, you realize we stressed home quarantine. So, but if there's need for quarantine in the community, a place within the community, yes, we are working towards securing places for quarantine. Mr. Dyer would have spoken of 2 that were identified, and we are also, within the Ministry of Health, looking at some other places that we would discuss too with disaster.
Okay, thank you. Because I'm really thinking about the visitors in particular, those ships out there, when the visitors come to our port and they need to, if there's need for them to be quarantined right away, if we can, if we have a place where we can take them.
Now, in terms of the ships, I need to clear that up. If we're going to quarantine anyone off of a ship, off of a vessel, it would most likely be a yacht. In terms of ships are a lot more controlled in that they present their declaration of health. The ship is moored by one of our port health officers to ensure that there are no sick persons that are coming off of that ship. So this has been going on for a long time. This has nothing to do with COVID. And that is why we are able, in at least 1 or 2 circumstances, at least twice, to deny entry of ships into our ports, because we are able to know beforehand what type of illness is on the ship, what number of persons are ill, whether or not they are in the sick bay, and things like that. And then we decide whether or not that ship can dock or not.
Thank you.
Any more questions?
Yes. Congratulations to the health department. This was a nice, informative session. I have 3 questions. First question is, you said, Dr. Nisbet, you said in your presentation that the MERS is confined to the East. How is it the COVID couldn't be confined to where it started?
Okay. Now, MERS, those very severe respiratory illnesses like MERS and SARS, what we know about them is that persons get ill, and they get ill quickly, and they are easily confined or isolated. They are quickly isolated. And that is why we don't have that large number of persons, right? Now, with COVID-19, a lot of persons have mild respiratory illness, and it's not easy to know that this person has COVID, because they may just have a snuffy nose or, a mild illness. And therefore, it's easier to spread that way. Understood?
Got it. Okay, next question.
Because there were containment efforts in China, but still, a number of persons would have left China not knowing that they are ill, and they would have left already before the containment measures were in place.
Okay. Another question is, in the quarantine room in your home, I think you said there was a time when the quarantine is over, you can come out of the room, etc., and do the regular living. What do you do to the room? How long does the disease last? For example, let's say I get better and I come out of the room. Can somebody go into that room and still be safe?
Okay, once the person, so we're talking about, quarantine or isolation. So you're going to want to clean that room, okay? We want to sanitize that room once that person is finished with that room. So we're not too sure how long the virus stays on inanimate objects. It could be, I've seen in the literature, few hours to few days. So remember, this is a new virus. But looking at MERS and SARS, up to 9 days, I have seen in the literature. So, and then in other literature, you see 5 to 7 days. So basically, you're still trying to find out more about this virus. But the thing is, household cleaners can be used to clean the environment once the person is finished with that room.
Okay. As well as you could air your lodging, as they will say.
And the persons are encouraged to be in ventilated areas. So there's a crosswind. So you open a window over there, open a window over here, because there's a respiratory illness, right? And just let it be a well-ventilated room that the person is in.
And do like what the old people used to do, put your bed out in the sun. Okay. Okay, the last one is the hand sanitizers you say are getting scarce. And I saw somewhere, well, I think I heard it somewhere on the internet. You can use vinegar and peroxide and put it together, put it in a spray bottle, and that could be used as well as a hand sanitizer. How true is that?
I have vinegar and
peroxide. Peroxide.
I don't know. I'm not sure that it can be used as a hand sanitizer. We promote alcohol-based hand sanitizer, and I'm not hearing any alcohol in that formulation. So,
you're running out of these things.
Hand sanitizer. So maybe it's better that you continue to wash your hands with soap and water, because remember, hand sanitizer is only a temporary thing. It sounds more logical if you use some alcohol and put something like some kind of moisturizing agent in that alcohol to be used. Now, I'm not promoting that, but it sounds more logical to me. Okay? So the best thing then is to try to wash your hands as often as possible with soap and running water. Oh, instead of a hand sanitizer? That mixture of vinegar and peroxide? Oh, well, I know hydrogen peroxide can work. I know that for sure. But I'm not sure about the vinegar. I haven't seen anything about vinegar, but I know hydrogen peroxide can be used as a cleaner.
Okay, I have two questions. Can the coronavirus be spread to the use of money? And can one person get this disease multiple times?
Second.
Yes, the first question was, can it be spread through the use of money? And the second question is, can an individual get this disease twice? Let's say they've got it, they've been cleared,
if you
can they
get
get
it
it the second
twice?
time? Yes.
Okay. Can it be spread by money? Well, we just said that it lives on inanimate objects for a little while, so it therefore follows, it seems logical to me that it can spread that way, right? Any dirty surface you can pick up germs from. So, yes, so we need to ask persons who are handling money to wash their hands often. And then there is the second question, if you can get it twice.
Yes.
So I know it was in the literature that somebody got it twice. However, it is thought that that person did not get it twice, but actually was not over it. And therefore, they started to get symptoms again. So,
Again?
We're still learning about the virus, so that is not clear yet. I've not seen that in the literature anywhere. You mean if, yeah, so I've not seen that in the literature anywhere.
Good day. I don't know if it's morning or afternoon. Good day. My question is, in somebody's presentation, they made reference that at their workplace, they had hand sanitizing stations. I think it was Mr. Manners who said that at the airport, they had hand sanitizing stations. My question is two-part. One, is there any plan to make that public, to create hand sanitization stations in Charlestown and throughout in public places? And two, is it practical for us to do hand washing stations where we can create areas where persons can go and wash their hand without going to a public bathroom or something like that?
Both of your suggestions, I like both of your suggestions. The only thing with suggestion number one, with putting hand sanitizers in different areas, I can think of things like pilferage and things like persons destroying things. Yeah. I prefer the hand washing stations in strategic areas. So that is something that that is why you're here, to give us some ideas. And that is not a bad idea at all. I think in the past we have had areas where I have seen pipes, tanks, and so forth in villages where persons could go and do things like those, but those are all gone now. So maybe it's something that we need to consider. And we want to encourage the business places to place hand washing stations within their business, and if that is not possible right now, to use hand sanitizing stations.
That's what I was going to say. Maybe coming from the health department, you can encourage business places to have these things at the entrance of their
And we have been doing
businesses.
that.
I know, the health and you have. So we can encourage the business places to do that, and we can even, well, maybe you can even partner with them to get the real hand washing at different points.
We have been encouraging the businesses to do that. We have been encouraging churches to do that also. So I'm sure you're going to see some churches with their hand sanitizer stations at the doors, and you're going to see business places doing the same. Once the dispensers and the hand sanitizers are available.
Okay, sorry, I have one more question. I saw on the news that a person, I know this is a new disease and, we're still unfolding certain things about it, but I saw on the news that a person didn't travel, they weren't in contact with anybody who had the virus, but they got it. Is that possible?
Well, as we discussed in the presentations, there are some persons who are having very, very mild symptoms, or persons who are asymptomatic may shed the virus, and therefore they can infect other persons. A lot of the times you don't know who's around you. They may not have traveled, but they may have been in contact with someone by going to the supermarket or something like that, and they were just in contact with the person close enough to breathe in droplets or touch the surface that was contaminated with the virus. So they may not have traveled, but there are other ways of getting it. And that is what happens when there starts to be community spread. Local transmission within a small area, and community spread within a wider area. Persons will not know where they got the virus from.
Any more questions before we close up for lunch? I think that's a no.
Okay, I would like to thank everyone that came out to our first session, our first symposium, the morning session. I would also like to give a special thanks to our presenters, Dr. Judy Nisbet, the Medical Officer of Health here on Nevis, Mrs. Dr. Retna Walwin, she's the Deputy Medical Officer of Health on Nevis, Mrs. Nadine Carty-Keynes, Coordinator of the Health Promotion Unit in Nevis, Mr. Brian Dyer, Director of Disaster Management here on Nevis, and Mr. Mikhail Manners, NASPA representative, also the manager of, operations manager of the Vance W. Amri International Airport. Could you please give them a round of applause? I would also like to give special thanks to Nevis Television 8 for covering our symposium today, as well as I would like to give a special thanks to our technical guy, Mr. Lexon Brown, and for LL for covering and making sure that we can see and hear the presentations today, as well as Ms. Sheila James, who also does a great deal in getting stuff like this together, and our staff at the Nevis Health Promotion Unit, of course. Before we leave, I would like to stress on two important messages that I want you to take from this presentation today. The first one, I want you to remember always that we should wash our hands. It's very important. It sounds like it's something simple. It sounds like something that people should do, but believe it or not, and I know this because of my field of work, a lot of people do not wash their hands when they're supposed to. And that is one of the reasons why you find certain diseases and viruses spread as they do, because simple, basic hygiene methods that we're supposed to be doing, we don't do as we should. So you should wash your hands, especially after using the bathroom and before eating. But because of what's happening right now, maintain hand washing very, very often. And also, and wash your hands with clean running water and soap, right? The other message I would like you to walk away with is when you're getting information, and Mrs. Carty-Kane stressed this in her presentation, when you're getting your information, try to get your information from reliable sources, as this is very important, especially in a time like this. So we are advising you get your information from CAFA, which is the Caribbean Public Health Agency, WHO, World Health Organization, PAHO, Pan American Health Organization, CDC, the Center for Disease Control. You could look at the Nevis, Nevis Health Promotion Facebook page and our Instagram page. And also the agencies that I called before, they also have a Facebook page and they have a website. So if you want to go outside of the Nevis Health Promotion Facebook page, you can go to those sources because those are reliable sources. And that brings us to the end of the first symposium for today. And I will see you later.